Hello and welcome back to the third week of Consider This, a brand new series where we simplify the science and public health behind COVID. I'm Marianne McDowell.
Hi, Marianne. I'm Heidi Beidinger, and we're co-hosting this new webinar series focused on the pandemic. And we have three guests today. We've got Dr. Mark McCready, Dr. David Layton, and they're both scientists here at Notre Dame who study transport phenomena and fluid mechanics. I'm sure that we're going to learn what that means because I'll need a bit of an explanation. Dr. Mark Farks is our Deputy Health Officer here at the St. Joe County Department of Health, who leads the COVID response for the county. He'll be discussing the effectiveness of masks as well as, or we will all be discussing the effectiveness of masks and the public health strategies that are being used to encourage mask wearing. We'll introduce them shortly, but first, as a reminder, our goal for the webinar is for us to help our community's understanding of public health and science as it relates to COVID.
We want everyone to understand the language that's being used in the media and conversations. So we've been providing small tutorials and uploading other additional materials. So please look at that before the sessions or even afterwards. We've also had several requests to submit or to post the answers to all of the questions that the audience is posing. We haven't gotten to that, but we fully intend to do that. So keep looking back. Heidi and I both have day jobs, so we're struggling to keep up a little bit. But please look back and we'll try to post as many answers as we can. And to remind you, you can always ask us questions by emailing us at consider@nd.edu. And I also want to remind everyone that we bring experts in to give you expert advice, but the views presented are the views of our guests and of Heidi and myself, and not the views or the policy of the University of Notre Dame, unless presented as such, like wearing your mask, which is a policy. And the information is not intended to serve, nor should be interpreted as specific medical advice or substitute for the advice of your own personal health practitioner. So with that, Heidi, should we introduce our guest?
Almost. I just wanted to add that last week we had this fantastic conversation about immunity and vaccinations with Dr. Shorey and Dr. Brian Baker. And if you missed it, don't worry, we've got it posted on our ThinkND webpage. It was awesome, you guys, you should check it out. And then as a reminder, please ensure that you're registering for the COVID-19 registry that's open to all Indiana residents. And we've got that link on the ThinkND page as well. So now we're ready to introduce our guests. So we're going to play the music, cue the guests.
Maybe they're not listening. Oh, there they are.
There we are. Oh,
nice.
That's a surprise. That's awesome. We're so pleased to introduce our show's guests today, Dr. David Layton, Dr. Mark McCready, and Dr. Mark Fox. I bet you guys could tell which ones, well, the names are all there. I was going to say the mask also gave it away. So let me introduce our three guests. David is a professor here at the Department of Chemical and Biomedical Engineering at Notre Dame and has taught courses in transport phenomena for over 30 years. He is principally known for his research into the behavior of concentrated suspensions important in areas as diverse as blood flow and oil and gas recovery via fracking. Most recently, he's collaborated with Dr. Mark McCready, and they've conducted a test with several types of masks, measuring the droplet emissions using particle image velocimetry and laser sheet imaging to determine which face coverings would block the emission of droplets most effectively. Mark McCready is a professor and senior associate dean of research in the Department of Chemical and Biochemical Engineering at Notre Dame as well. His research includes multi-phase fluid flows and CO2 absorption and reaction in multi-phase systems. Additionally, his work focuses on the microfuel cell technologies and the fundamentals of phase change processes. Mark Fox is the Deputy Health Officer here at the St. Joe County Health Department, leading the COVID the county's COVID response, as well as serving as an advisor to the Notre Dame leadership on their COVID response. In his spare time, he's also the Associate Dean and Director of the IU School of Medicine here in South Bend and Professor of Medicine and Pediatrics. And before coming to South Bend, he was the Associate Dean for Community Health and Research at the University of Oklahoma School of Community Medicine. My goodness, we have quite the panel of experts with us today. I also wanted to say, in full disclosure, Mark Fox and I have worked together for, I think it's nearly 5 years. Is that about right? Yeah, it's 5 years. When Mark first moved to South Bend, we almost became immediately acquainted because we were both interested in community health and community-based research. And then we served on the board together, the Board of Health together, and began our work on lead poisoning prevention that emerged in 2016. So, and now we have Mark as our Deputy Director, and we're very fortunate to have his leadership. So welcome to the show, to our 3 guests.
Heidi, thanks for inviting me. I'm happy to be here.
Looking forward to it.
Thank you, guys. And I want to have a shout out to Heidi that she volunteered to give the introductions and read all of that. So I'm glad it wasn't me. And one thing I did notice is that we have 2 Marks, and usually we go by first names. And so I'm hoping we can use a nickname for Dr. Mark Fox, and I think we'll call you Foxy, if that's okay with you.
It wouldn't be the first time. So my father-in-law is also Mark. And so my wife always calls me Foxy when we're gathered as a family. And in fact, one of the med students a year or so ago at the end of a session said, "Okay, Foxy, what's next?" And then she was just horrified when she realized that she just called the dean Foxy. I was convinced that my wife would put her up to it. So that's been a long running joke now.
Well, that's good. I thought you were going to tell us something a little too personal there for a minute. So I'm glad it went the other way. But let's get the conversation going. So we ask all of our guests usually to talk just a little bit about their work and tell us how they got into science. And so I'm going to ask all 3 of you to talk about that briefly. I say briefly because I know I'm a scientist, and if somebody asked me, I would take the whole hour, and we want to get to the masks. And so I think I'll start with you, Mark McCready. Could you give us a little insight into your work and what got you into science?
Yeah, I'll answer the first question, last question first. I grew up in the age of the manned space flight, and I was completely enthralled by how that all happened. And then as I got older, I went to school and I was good at math and chemistry. My dad said, "Why don't you be a chemical engineer?" I went to the University of Delaware, and from day one, I loved it. And I immediately knew I wanted to be a professor, and then went to the University of Illinois. I came here. I was lucky enough to get a job here, and this has been great ever since. So the kinds of things that I work on day to day are fluid mechanics and what happens inside process equipment when very complicated reactions are going on. But that's enough.
Thanks. How about you, David? Can you give us some insight?
Okay, well, I'll start with the second part first as well. I suppose, in my case, actually, it goes back to when I was in high school and in junior high school. I got involved in doing science fair projects at a pretty high level. Even as a senior, it got me a trip to the Nobel Prize ceremonies in 1976.
Wow.
Which was quite an experience. But after doing all that, I got bitten by the research bug. And so I continued doing research through my undergraduate days, and then in graduate school, and then a postdoc, and then here. So it's something that I've always found very interesting, trying to go and see if I can understand what's going on in different systems and how, as an engineer, we can design them better.
And so is your work focused on masks, or do you have other kinds of work as well?
I tend to do experimental work as well as mathematical analysis of experimental work. So the idea is to try to understand what's happening in a physical system and then to describe it mathematically. But I've always found that it's kind of important to do the experiments so that you actually have your theory grounded in reality.
To see if you're right. Yeah, I get it. Okay, Foxy, it's your turn.
So one of these does not look so much like the others. I went to undergrad as a biology major, thinking I might want to go to medical school, but I really can't stand the sight of blood, and I thought that might be a career limiting deficit for me. But I loved the philosophy and theology, and actually ended up as a theology pre-med, and never quite got the theology out of my system. I was this close to becoming a Jesuit priest. I went on and did graduate work in philosophy and theology, and then did an MD PhD, but the PhD is in theology. And actually didn't come to public health until my fellowship. But over the course of my career, my interest in ethics and in community health really has combined. So I'm really focused on health disparities and innovative solutions to health inequity. And so that's what all comes together in combining medicine, ethics, and public health. For me.
Yeah, that's definitely awesome. So the pandemic is keeping you busy, I think. Yeah, thank you so much for sharing. I think it's insightful to us, but also our audience as well. And I think people are interested in how we got here. So I guess we should keep going. And I did have an email that somebody emailed us, and so I'd like to read that. Lacey Airhern from class of 2003 emailed us, and I must admit that she's also an adjunct faculty in the Eck Institute for Global Health, so she's also a friend. Hi, Heidi. Hi, Lacey. So Lacey writes, Heidi and Marianne, thank you so much for doing this webinar series. The information is timely and needed in the community. I'm hopeful that Dr. Fox can talk about contact tracing in St. Joseph County and how that program interacts with the Notre Dame contact tracing. For example, if an ND staff member tests positive and has contacts outside of the Notre Dame family, who does the contact tracing, the Notre Dame program or the county tracing program? Thanks again. I love the program, but of course I'm a public health geek. Thank you, Lacey, from one geek to another. We appreciate your email. But Foxy, do you think you could talk to us a little bit about the two contact tracing programs?
Yeah, if I can just say something about contact tracing generally to begin with. You know, we often think of contact tracing as both forward facing and backward facing. So when someone is diagnosed with COVID, the low hanging fruit is forward facing. So we go back 48 hours from the time of their either symptoms or the time of their test and try to identify everyone that they've been in contact with during a time when they likely were infectious, so that we can get them into quarantine and stop the transmission of the virus. That was what was so critical in Notre Dame's response back in August with the big spike in cases. Backward contact tracing looks to see where were you likely exposed. That's much more time-consuming work. That's what we did with the football outbreak, is to say what changed. So we got the roommates and everyone else in quarantine, but trying to uncover what the path of transmission is. So the Notre Dame contact tracers really work as an extension of the local health department doing contact tracing for the university community, but it stops at the university edge. It stops at the border of the campus, essentially. So that campus community interface is what's really challenging to navigate. But for St. Joseph County, actually the State Department of Health contact tracers do all that contact tracing. So we tried to facilitate an arrangement where the state would just turn everything, all the responsibility over to the university contact tracers, who we knew could be very timely and would have detailed information about class schedules and dorm assignments and all that. The state would not just turn everything over. So any student, faculty, or staff member should be contacted by university contact tracers and by state contact tracers, but it's the state that looks at all the non-university contacts. So if you went to Brothers, the state should be picking up all the Brothers contacts, if you But I think it's important that people understand the forward and backward aspects of contact tracing.
How well would you say, or Foxy, excuse me, how well would you say that contact tracing is working at the state level?
You know, the state has been surprisingly timely in their contact tracing. We've had situations where patients have learned of their COVID diagnosis because the state contact tracer contacted them before their doctor's office got them a result. That's not ideal by any stretch of the imagination, but it does speak to their timeliness. And I think they're pretty good at the forward facing, and they have not been as robust in the backward facing underlying exposure trajectory as we would have hoped. And so we actually have devoted resources here locally at the health department focused on that backward facing question so that we can understand where people are likely getting exposed.
And then one more definition. What's the definition of a close contact?
So strictly speaking, the definition of a close contact is somebody who's been within 6 feet for more than 15 minutes. And it's agnostic as to masks. And so actually most of the mitigation strategies in place on campus are designed so that you should never have any close contact in your classrooms or any place except your dorm room or with your significant other, somebody that you're unmasked with. But ideally in the classroom setting, no one should ever meet that definition of a close contact.
Okay.
Yeah, it's really interesting, but that also brings us to the data.
Yes, exactly. And so, yeah, and so a week in a review, when we look at like last week's data, what a week it was, we saw significant increases here in St. Joe County. We've got significant increases in Indiana, here in Northern Indiana and Southwest Indiana, that resulted in a Chicago travel ban. And then also Dr. Box, our state health commissioner, has tested positive. And then of course, Notre Dame experienced an outbreak early last week as well. So during last week's show, I reported that Indiana had set a record for their highest daily new cases on October 10th with 1,900 cases. And now a week later on October 17th, they set yet a new record for 2,485 new cases on one day. So that's a 30% increase. And so obviously we're not headed in the right direction, right? The trend is not going the way we want it to go. And yet we all know what we need to do, but I feel like that we just need to keep repeating it. And because we are concentrated on the science and the public health of this, I'm going to take that opportunity to do that now. Social distancing, reducing visits to grocery stores and stores, so reducing our exposure to crowded places and spaces, hand hygiene, perhaps moving to virtual religious worship. And of course, we need to wear our masks. And so we're so glad that the three of you are here today so that we can discuss this topic.
Yes, and that brings us to the headlines. The data is depressing, but I have a whole bunch of headlines. This week has been all about masks, so I have a ton of mask headlines. But first of all, I want to say a positive headline. Actually, Rochelle Mammaleni Googled it on the Google Sheet, emailed in, and she alerted us to a recent 2020 3M Young Scientist Challenge. And a young woman of 14, Annika Chebrolu, she won it, and she won $25,000, and she won it for using in silico modeling to try to find a drug to block the SARS-CoV-2 virus by blocking the spike protein. So I thought that was some good news. And then David, that reminded me of when you said you won your science fair project. I think that was the deluxe science fair project. So thanks to Rochelle for alerting us. So the headlines about masks. So there's some funny ones. My favorite two are how to avoid mask breath, which I think we're all experiencing every now and then. The other one was fashion forward bridal masks. So the whole fashion industry is also changing. More serious ones, White House blocked CDC guidance on masks. I think that was about public transportation. another one, in fights over face masks echoes the American seatbelt wars. And I think that's kind of a topic we'll talk about a little bit later. And the last two are St. Joseph County Council puts mask fines vote on hold. And I think there is something about that in today's paper as well, as maybe not everybody's agreeing. But the one that I really want to talk about today is Trump falsely cites CDC mask data on mask wearing catching COVID-19. And so this is in his town hall. He stated that people who wear masks, or 85% of people who wear masks, get infected with COVID-19. And he was citing a specific CDC study. And so I was hoping, Foxy, you could talk about that study a little bit and set the record straight.
Yeah, so what President Trump was misunderstanding about that study, it was published in the CDC's MMWR back in September. And it was really a case control study that looked at a group of people who were diagnosed with COVID, a control group that had not been diagnosed, and looked at both their patterns of mask wearing, but especially their exposure history. So this is the backward facing contact tracing. And you know, the people who became infected with COVID, 85% of them reported wearing a mask, you know, most of the time or all the time in public. The control group, 88.7% reported wearing a mask most of the time or all the time. So not a big difference there, but the study wasn't designed to look at mask wearing as a risk factor. It was really looking at the exposure history, and what that paper demonstrated was the risk of being in enclosed public spaces, like especially associated with eating and drinking. So restaurants and bars where people are necessarily unmasked, but also where they're often engaged in conversation. So generating droplets, and you think about the ambient noise, they're also probably likely talking more loudly than they would in normal quiet conversation. All of that promoting more droplets and more exposure risk. And so the study was really about the sites of exposure. The mask wearing was just one of the demographic factors that they looked at, but not a big difference between those two groups. So totally taken out of context at the most generous and completely misunderstood as a possible explanation as well.
You know, Mark, Foxy, I keep wondering, I'm thinking that that article is going, and that data is going to be brought forward on Wednesday's Board of Health meeting. Probably. So I'll let you handle that when that gets brought forward. So anyway, let's move to our next segment called Rumor Has It. Marianne and I came up with this as a way for us to bring forward like myths and rumors that we're hearing in the community from friends and family about all things related to COVID. So we have a rumor for each of you. So David, if you would take this one first. Rumor has it that net gaiters are the worst protection. Is this true or false?
Sometimes.
Oh no, in the middle.
Sorry about that, but that's, you know, it's whatever you say. Is this true or false? The answer is, well, yes and no. So I thought, you know, to start, I thought it would be kind of useful to go and describe what it is you're trying to do with a mask. And so let me go and share a screen for just a second.
Mm-hmm.
What this is a result of some of the experiments that we were doing with Mark McCready. And this is what happens in a laser sheet when you say stop. And so it gives you an idea of the kind of stuff that comes out of your mouth when you say stop, or any words. But the problem is that those particles, which are really too small to see, are going to potentially contain viral particles if you are infected. And so the idea behind a mask is to try and capture the stupid things before they get out and infect other people. So the question is, will masks be able to do that? And the answer is, well, yes, but it depends largely on the material. So here's a gaiter. This is one which was provided to me by Troy Vogel, who's one of the faculty in our department. This is after I encouraged him not to wear this anymore. And I don't know how well this shows up, but I can actually see the screen, see you guys perfectly well through this gaiter. The material is much too thin to really provide any kind of protection. And we've actually looked at this material that's this thin and shown that it really doesn't work. Oops. We also had some material. You're like turned off, did it, Mark? Yes. Mine may do that shortly as well. We were provided with gaiter material by the football program because the head football physician wanted to find out whether the masking that they were using in their exercise program was sufficient to go and protect the students. And so he asked me to go and take a look at a gaiter. And so this actually is a Port Authority gaiter, which is a better material than that thin gaiter that I showed earlier. And in fact, when you look at this material with the laser sheet, it actually does pretty well against many of the vocalizations, but not all of them. In particular, if you go and say pop, what you find if you go and put your hand in front of your mouth and say pop, you can actually feel the force of that plosive sound coming from the letter P. If you put a mask, a regular mask over it and put your hand in front, you really don't feel it. If you do this, pop, you feel something, not much. So it actually does attenuate things fairly well. But the interesting thing, and what Matt asked me to go and look at, was what happens if these got wet? And I think that's one of the more interesting things to look at. So I'm going to put on this gaiter, and then I'm going to take a water bottle, and I'm going to squirt myself. And so it's only a couple of milliliters. Oh, I missed. Oops. Only a couple of milliliters, but I'm going to show you what happens when you say pop. Pop. And I don't know if you can see that very well, but if you look at that, it's coated with little tiny drops.
Twist a little bit, Dave.
There it goes.
Yeah,
Yep,
there you go.
I see it.
Can you see that?
Yeah.
But literally, that's just one expression of there. That I think sees it a little bit better.
Yeah.
Yeah.
Yeah. There we go.
It's kind of
now you
gross.
can see that. That's just one saying pop once. And the problem is that if you get into a conversation with someone wearing a wet gaiter, and it could get wet either from a water bottle or from sweat or from rain if you go out there right now, because it's a little damp outside. And then if you say anything, then all of the material which had been previously captured by the gaiter, all of your previous conversations, all the previous droplets you captured, would then be happily sprayed out. And so that's the reason why a gaiter, well, the answer is yes and no. Don't wear it if it's going to get wet. And at least if it does get wet, just don't talk.
Wow.
So the other thing that we've been hearing is that the gaiter material will make the larger droplets smaller and change them more into like an aerosol. Is that true?
That was the argument that the Duke researchers were making, but some other researchers at Virginia Tech were saying that no, we don't think that could happen, and it's not, it's not real clear exactly what the Duke guys were seeing in their experiments. In fact, actually, the drops that you're seeing that are being produced here aren't smaller; those are actually quite large in terms of production. You're producing a huge range when you just simply say pop with a wet gaiter. It's complicated. One of the problems with the gaiter is that because of the elasticity of the material, it's held very closely to your lips. And so when you say something like pop, there's no way for the air to get away. It's going to be forced right through the material, right over your lips. Interestingly, one of the other things after we've done this study, one of the other things that Under Armour, who works with the university on trying to go and come up with various ways of clothing athletes, including doing masks, what they did was they came up with using their sports mask and incorporating that into a gaiter. And this actually is available. I just looked it up online. It's available for pre-order. I think they say they'll be shipping in mid-November. But the idea behind this one, and why this one is better than a regular gaiter, is because although it has the gaiter material around the sides and so forth, what it does is it basically just has a Sports Authority mask sewn into it. And the way that is designed is like many masks, it's designed to stay off your lips a little bit. And so when you say pop, you do not feel anything. And so I can spray it and go pop all I want and blow through it. It will not produce any droplets.
Just like everything else in this pandemic, everything's evolving and we're learning as we go and make things better. One thing I wanted to point out to our audience, which I thought in a way was nice about the science, is you were saying that you guys or the Virginia Tech guys disagreed with the people doing the research at Duke. And that's the way science works. We talked about peer review, and I think last week we talked about and the importance of peer review, but also different groups repeating experiments. And so finally lots of publications and lots of researchers come together, and that kind of changes the way science goes. I think it's the way science works, and it's a positive thing. So we had another rumor, and this rumor is that we've been hearing that carbon dioxide can build up inside the masks and be dangerous if worn for long periods of time. Mark, is that true or false?
That one's false. As David mentioned, there's a little bit of space in order for the mask to work correctly, maybe a few milliliters, but every time you breathe about 500 milliliters in and out. You do this many times a minute. And so you're flushing out that dead space many times a minute. The CO2 and oxygen and nitrogen go right through the mask. They're too small for the mask to have any effect at all. And the CO2 doesn't absorb or stick to anything that would otherwise cause you problems. So that's not a problem at all.
Good to know, because you hear that by a lot of people.
You totally do. Yeah, we've heard it many times. I had a student ask me about it today, as a matter of fact. And then finally, our last rumor for Foxy, folks are claiming that masks violate their constitutional rights. Is this true or false?
So I'm not a Constitution scholar, but I'm the son of a contract lawyer and have been called worse. But everything that I've seen suggest, people will cite their constitutional rights and freedom of expression, which certainly is an important right. And yet, particularly in the setting of a pandemic, most courts have ruled that there are some reasonable restrictions because there are impacts on the health of people other than the wearer. And so we can impose some reasonable restraints of various kinds, including requirements to wear masks. So, this happened 100 years ago with influenza. It's happening now. I also often think about just the simple no shirt, no shoes, no service. And I know people will point out to me that that's not necessarily in the code and it's not law, except that it's become a cultural norm that no one argues against. They don't walk into 7-Eleven and say, I assert my right to be topless while I get my Slurpee, thank you very much. And so we need that same kind of cultural norm to apply, I think, in the setting of a pandemic and a piece of fabric across covering your nose and mouth.
I think I remember the no shirt, no shoes, no service. Like, I think I was a kid when that started coming out, because we used to go barefoot all the time to Dairy Queen, and we had to start wearing shoes.
Funny, David and I don't remember that. You must be much older than me.
You know what, though, you know, just as a comment on the public health aspect of what you said, Foxy, is that, you know, this is the struggle of public health, right? I mean, we're trying to advocate on the behalf of the American public, and people then want to make an argument for themselves individually. And while you can be inside of your home and make choices about what you want to do, when you're out in the public and you're interacting with the public, we have these cultural norms. We have these expectations that people are going to follow, the no shirt, no shoes kind of thing, or wearing a seatbelt for that matter, for the protection of themselves and that sort of thing. So I think it's an ongoing struggle until the time that that they realize, that the folks who are the anti-maskers just realize what it actually is doing to protect the public. And then I would add one other thing, because Marianne and I were just having this conversation about this, and that is, had we started the pandemic with leadership from the top that had demonstrated and modeled the behavior that we needed, that I think this conversation would have also gone in a different direction. So there's my political statement for the night.
I also think if we rewind, 6 or 8 months back in the pandemic, there was considerable uncertainty about the merits of cloth face masks for the general public. So there was some uncertainty about their efficacy, but a lot of the mask conversation 8 months ago was the general public doesn't need to be wearing N95s or surgical masks, not because they're not effective, but because there simply haven't been enough to keep healthcare workers stocked. And so we didn't want to deprive those caring for COVID patients from having what they needed. But I don't know if the real scientists, have a comment on the perspective 8 months ago about the efficacy of cloth face masks. But, there was uncertainty, I think, about whether or not to recommend them back in March and April timeframe, I think. But pretty quickly that, I feel like, got resolved.
Well, that's the perfect segue into our next question for David and Mark about your research on masks. So we'd love for the two of you to, give us the overview of the research that you've done on the mask, and tell us what works and what doesn't.
Yeah, let me first start. Since David did all the hard stuff, let me set this up. You notice this series is sponsored by the provost. And she actually started this. She was interested in some questions that she couldn't get answered about masks and shields with respect to teaching. And she asked Bob Bernhardt, is there anybody on campus who can do it? He came to me and I said, well, I know David Layton's the whiz with laser optics and imaging, and he would be the perfect person to set up an experiment. And so I told David we needed to do this. And so David did this. And so we worked together at first, but actually, all of the really major accomplishments here were done by David. And at some point, of course, it wasn't safe even though we did it, it wasn't safe for both of us to be in the room at the same time anyway. So David can tell us all the details of the key findings.
Well, okay. So the first question that was asked was, do face shields work? Okay. And in fact, actually, it's kind of interesting looking at football games. The primary protection in any kind of a football game, of course, is the fact that everybody is tested very rigorously to make sure nobody's infected. Because if nobody's infected, nobody's going to catch it. On the other hand, I always kind of find it rather interesting to see all the various things that the coaches are wearing on the sidelines. And in fact, actually, this mask, the new Under Armour mask, is what Coach Kelly was wearing in the last game against Louisville. But one of the questions that was particularly important was, can you wear a face shield as opposed to a face mask? And that's because a face shield, it's much easier to communicate with. It's also more comfortable, but it's much easier to communicate with. And the question was, does it work? And basically by doing analysis of existing stuff in the literature, as well as doing some experiments, the answer is there's no free lunch. No, a face shield does not do what you need to do. And the reason why is because it's not capable of filtering anything. It's not capable of stopping stuff. The mechanism of a face shield for catching things is via something called inertial impaction. It's basically droplets going out and whacking at the surface, as opposed to following the streamlines and going out and infecting your neighbor. So one of the things that we were asked to look at was this thing, which is a clear mask, which is a way in which, yeah, Mark has one of those as well. The way in which this is works is the following.
Is that like plastic or is it breathable?
It's plastic. Okay, so I mean, ultimately, the way in which you can absolutely prevent any particles from getting you or infecting anyone else is putting a bag over your head and tying it off. But there are, in fact, undesirable consequences. So the question is, how do you actually manage to trap stuff without having things still being able to breathe through it? And there are a number of different ones on the market. This one is a semi-disposable kind of a unit that was provided by the College of Engineering, and basically what it is, it's nothing more than a mask itself. And,
you guys know this is being recorded, right?
Yeah, well, what can I say?
Gotta get these
but
really tight.
This actually works. It works pretty well, okay, in terms of doing of being able to more or less see through it. You do have there's not a lot of filtration going on, so I think it doesn't really protect you against aerosols significantly, but it because it escapes out if you have it properly tightened, which is a little hard to do, in fact. If you have it properly tightened, there's not too much leakage around it. Most of the air going in and out gets filtered, not so much through not escaping out the sides, mostly going out the foam. But in any event, one of the ways of testing it and demonstrating that this will actually protect other people to some extent is something which I call the hiss test. And so the idea is, okay, if you have something like this, if you want to see whether or not it works, all you have to do is go, and then you take it off and you look at it. And so if you look at it, and hopefully you can see this before
there you go. I saw it.
There you go. All right, so you can see that. That's liberally coated. Okay, and that means that via inertial impaction, all the liquid that came out when you went hiss got captured. Okay, and so it prevented it from going out and potentially infecting other people. Unfortunately, if you do exactly the same experiment with a standard face shield and you hiss at it, you don't see anything on the shield. In fact, they're designed not to capture stuff because the way they're designed is they're designed not to capture that material. And so
David, when you're talking about a face shield, are you talking about that long plastic thing that comes over the front? Okay.
Yeah, full face shield, right?
Yep.
Full face shield, partial face shield, and so forth. And so basically what happens is that it might intercept the very largest drops, but the vast majority of stuff that comes out gets away, and so it doesn't act. The inertial impaction doesn't work for that kind of a system. You can demonstrate exactly why. Face shields are very important in a medical environment, but they're not a replacement for a mask. They're a supplement. The idea behind a face shield is to go and prevent spray from an infected patient or someone who's coughing in your face from contaminating your mask or getting things in your eyes or whatever. But they're not designed to go and protect the other person necessarily from droplets that you're emitting when you breathe, or protect you from aerosols, because they can't.
So you would say that wearing a mask is really your responsibility to protect other people, and maybe a face shield is to protect yourself.
No,
No?
a face shield is designed to protect your mask.
Oh, okay.
That's what it's designed to do. And that's its principal purpose, is to prevent stuff that might be splashes, that might be coming out from getting into your eyes, or getting your mask itself, the surface of your mask contaminated. It's a complement to a mask. It's not a replacement in any way, shape, or form.
It's pretty interesting. So we're getting to the time where I think we need to take some questions from our audience. We always like to have a few. And the first one I have is an anonymous person. And they want to know how far, I think it has to do with the social distancing. So how far do droplets travel? Is 6 feet enough?
Well, in most cases, the large droplets will fall to earth by that distance. They fall faster in the humid summer air than they do when they dry out quickly in the winter. But if the particles become aerosolized, then it'll fill a room, and then no distance per se will protect you. And so it's sort of it just depends on the mechanisms of transmission. So there's certainly more load from big particles close, but once it gets in the air, it's in the air.
And so you said inside, so aerosol outside. So would it be better for me to actually go to the Notre Dame football game, or go to Brothers and watch it, or have some friends and family over to watch the game, in terms of transmission?
So the most dangerous place you could think of is you and 5 friends in a small apartment cheering for 4 hours. Because the air circulation is low, the volume per person is small, and it'll build up in the air. And so if my calculation for that I've showed to people around here is that you would get 40 times the dose that you would from that 15 minutes and 6 feet in the the contact trace kind of thing. So 40 times that. So that surely is not safe. Now, wearing a mask will knock that way down. Okay. And that's how you're protecting other people.
Yeah, I mean, I think that's really important now that it's getting cold outside. It's harder to, I certainly am not sure I'm going to go to that December football game. So I need to think about
being outside in the game is not nearly as hazardous as what Mark was saying as being inside. You're much better off going to the game than hanging out with your buddies and watching it on TV.
You know what, can I ask a follow-up question from Mark McCready's comment, and ask Foxy about, so, if Mark is saying that, if there are 5 people inside of a small apartment, isn't one of the guidances something about, like, we're not supposed to have groups congregating larger than 10? But in that example, he's saying 5, and we've got a 40-time higher risk of getting COVID or transmitting it. How do we reconcile those kinds of things?
Yeah, the guidance about gatherings, I think is really trying to find some kind of compromise. Anytime you gather with anyone other than your usual cohorts, your household members, there's increased risk. If you're, as Mark said, if you're in a relatively small space with poor air circulation, then those aerosols will build up over time. We think that the dose, the inoculum in aerosols, is relatively modest. So the bigger risk is still going to be with the large droplets. But again, if you've got 5 people in an apartment, and if they're your buddies and you've got your mask off, cheering on the Irish, there are going to be a lot of droplets there. I still would argue that the droplets pose your greater risk than the aerosols that build up over time. And actually the recent experience, kind of the current spike in cases points to some, game watching parties from last weekend. People gathered inside unmasked. and we saw an associated increase in cases coming from those gatherings.
Wow.
The other
Thanks.
issue of the numbers is the following. If you have, if you have a group of 5, then you have, supposing you have a large number of people and one of these people is infected. Then if everybody's broken into groups of 5, then 4 other people would be infected. And then once you manage to track them out via contact tracing, you pop 4 people in quarantine. If you have groups, if you take exactly the same numbers, but have them in groups of 10, with still only 1 person infected, now you got 10 people in quarantine and 10 people that are probably infected. So in other words, the situation is such that the larger your group, the more likely it is you're going to have a lot more difficulty tracking everybody down and eliminating the cluster.
Yeah, for sure. So we have tons of questions. I'd like to go to one that was submitted earlier, and this is from Helen Colley. And she actually writes quite a bit, but I think what her point is that we have these dashboards, in particular in St. Joe County, we have yellow, green, yellow, red, and that we're in red, but still schools are opening. And what does this mean? Do we need to change? I mean, maybe Mark and Heidi, you guys can, or sorry, Foxy and Heidi, you can talk about this a little bit and where we are in the county.
Yeah, so the county metrics that we issued for school reopening, we issued back in July, when there was really just very little communication either at the state or the federal level about school reopening guidance. And the basic premise of it was that the level of COVID activity in the community should be a relevant consideration as we think about bringing people back to a K through 12 school. And I do think that K through 12 is a little different than even a residential college campus, because on the college campus, classes are 50 minutes or 75 minutes, or maybe an occasional seminar that's longer than that, but then people disperse. And certainly living in a residential, residence hall has different risks associated with it. But you think about elementary school where you've got 20 to 30 or more kids in one room, often not able to physically distance, but they're spending 6, 7, 8 hours a day gathered together. Again, to Mark McCready's point about the number of aerosols that build up in poorly ventilated classrooms for that period of time is a challenge. So we issued guidance trying to draw people's attention to the level of COVID activity in the county that are characterized by the 7-day rolling average of new cases per day, the number of active cases in the county, which we define as the number of cases over the preceding 14 days. So the group that is still at risk of being infectious, the percent positivity, and then we use an estimate of R naught that is developed by a group nationally that does this for all jurisdictions. But that combination of things gives you some sense of just how prevalent the activity is in the county. Subsequently, the governor came out with a different set of metrics, looks at a lot of the similar cut points. He looks at 1 week, the number of cases per 100,000 population, the percent positivity, and the rate of change in the percent positivity. So his cut point, his metrics are similar. He uses different cut points and is much more permissive as to what's allowed at each of those cut points. The CDC then came out with their school guidance 2 months after the school year started. So schools are trying to juggle all of that and pressure from parents and I think all of us would agree that the ideal thing is to get K through 12 students in school in person. for lots of reasons. There's been conflicting guidance about how infectious, especially younger children are, what they have similar viral load, but whether they're as likely to transmit it. And I think there's mixed data on that. But I do acknowledge, I feel for school boards trying to juggle competing guidelines and competing demands there. Bottom line is that, what's happening in the community matters. We haven't seen a lot of in-school transmission to this point. We're beginning to see more schools with multiple cases. Elkhart has had a little bit more in that regard than we have, I think, to this point. But yeah, that it's just a challenge. And I think, again, Heidi made this point earlier, that the failure of leadership at a federal level, they kick the can down the road to the state. The states kick the can down the road to the local level. I feel like we're lucky in St. Joseph County because we have all the healthcare systems and Dr. Einter's. We have this whole group of people that meets regularly trying to help navigate that. So I do feel like we're in reasonably good shape compared to a lot of other counties in the state that don't have that kind of structure or resources pulled together.
Thank you.
Well said.
So I think we're getting to the end.
We are. Do we have time just for maybe a couple of quick lightning round questions?
I think so.
Okay, good. Because this is a fun part. So Mary Ann and I thought it'd be fun to do a couple of what we call lightning round questions so that we just get to know you all a little bit better. So I will go first. Are y'all ready? All right, here we go. So Mark McCready, you go first. What is your superpower?
I play the piccolo trumpet.
David.
I bicycle a lot.
Awesome. Foxy.
4,000 miles this year.
Wow.
Did you say 4,000?
About 4,400 this year.
It's a lot.
That's a lot. Foxy.
I can fall asleep at the drop of a hat,
We've had that
especially
on
the last 8 months.
Who said that they could do that?
both the provost and Brian Baker.
That's right. Oh my gosh.
All right,
Awesome.
so it's my turn. We will start with Foxy. What's the last show you binged and loved?
So I'm a little embarrassed to admit this, but with my youngest daughter, who's a big fan of the Gilmore Girls, she had me binge watching the Gilmore Girls, and I think that Rory Gilmore might be my soulmate.
Okay, David, how about you?
With my family, I watched all the Miyazaki flicks.
Oh, I didn't know that one.
There are
Wow.
a lot of them.
Mark?
Brokenwood on Acorn from New Zealand.
No, I don't think I know that.
Don't know that one either. I got to write those down.
Yeah, okay. Maybe go to the last one, Heidi.
Yep, that's what I was thinking for. David, what are you deeply grateful for right now?
Inquisitive students.
Oh, Foxy?
My daughter's resilience.
Awesome. And Mark McCready?
The fact that we took the chance and opened the Notre Dame to have real people, real classes and real things, and we're going to make it.
Awesome.
I really
Awesome.
love that, you guys. So first of all, thank you so much for being our guests. I think it was wonderful. And I want to encourage our audience to share what you learned today with your friends and family. And if you have any suggestions for us or questions, please email us at consider@nd.edu. I hope that you tune in with us next week when we'll be discussing COVID and college athletics with Athletic Director Jack Schwarbrick and Tricia Balia, the chair of the Faculty Board on Athletics. And I want to get a shout out to Bridging the Divide, which is actually starting right at 7 o'clock. It's also a Think ND series and hosted by the Provost Office. And the title of this webinar is The 19th Amendment and the Myth That All Women Vote the Same. And also on Wednesday, Bridging the Divide at 8:15, Mayor Pete and Ann Thompson will be talking about rebuilding trust in our nation's institutions. So I encourage you to tune into those. I'd just like to leave everyone with a quote from Chris Christie. the former New Jersey governor. He recently was released from the hospital recovering from COVID that he contracted at that infamous Rose Garden event. And he said he was wrong for not wearing a mask. And his quote is, "I believe that we have not treated Americans as adults who understand truth, sacrifice, and responsibility that I know them to be." And I thought we should have trust in all of our fellow Americans. So consider this. The more you know, the more good you can do.
So be informed and act on accurate information.
And share reliable information with others.
Until next week, be kind and give grace to each other. And now together,
And wear
wear
your
your
mask.
mask.